My name is Leah Sera. I am the Associate Dean of Recruitment, Admissions, and Integration and an Associate Professor in the Department of Practice Sciences and Health Outcomes Research. My path to pharmacy was a bit non-traditional. When I started college, I thought that I would be a teacher, maybe a high school history teacher. And I spoke with a classmate and they said, well, what are you going to do for money being majoring in history? And I thought, maybe I should take a science course. So I took some science courses and found out that I actually liked science and I did well in my science courses. And around that same time, I met a pharmacist who was a community pharmacist. She really loved what she did. And so I started thinking about a career in healthcare. At the time, I was working in a veterinary clinic. I thought that maybe being a veterinarian was going to be my way to contribute to healthcare, but ultimately I decided to go to pharmacy school. So yeah, I completed my prerequisites at Montgomery College, which is a 2-year community college in Montgomery County, Maryland, and applied to pharmacy school. First year I applied, I was waitlisted, but I persevered and started in 2006. So I had a lot of transitions in my experience as a student pharmacist becoming, a practicing pharmacist. When I came to pharmacy school, my assumption was that my career path would be community pharmacy. That was really what I understood about pharmacy when I started pharmacy school. In my 3rd year, I was able to take an elective course, which was called at the time Care of the Terminally Ill. And we learned about taking care of patients with advanced complex or terminal illnesses and the teams that work together to help to palliate symptoms for these patients. And I was just enthralled by this area of practice, which allowed me to use my pharmaceutical knowledge, pharmaceutical calculations, and my drug knowledge, but also really stay in touch with the human element, connecting with patients and family members and caregivers on a more emotional level, and that really spoke to me as a passion and a career path. So because of that, I ended up doing 2 additional years of training, did 2 years of residency training, and after that I decided to join faculty. I love being a faculty member. For me, it's come full circle back to teaching, where when I started, as a young adult thinking that I was going to be a high school teacher, I really came back to wanting to be a teacher and to connect with students. And one of the things that I love most about being a faculty member is that when I'm around students who are so excited about their future and have so many ideas about how to improve healthcare and improve patient care and improve patients' lives, it helps to keep me also excited, motivated, and optimistic about the future of our profession. I learned so much about myself personally and professionally at School of Pharmacy. I met individuals who are lifelong friends of mine, who were peers of mine in my pharmacy school class, and then because I stayed here as faculty, I have become friends with individuals who were my pharmacy school teachers, who became colleagues and then friends. One of the things that kept me at the School of Pharmacy was this feeling of, as soon as you're here, you're part of the UMSOP family. And I felt that from the very first day of Welcome Day in 2006, and I still feel that today. The biggest benefits of attending the University of Maryland School of Pharmacy are one, the ability to really customize your education and explore different ideas like I did. I started out thinking that I was going to have one career path in pharmacy and ended up doing something very different because of the options I had in elective courses and elective rotations, and because of the internationally renowned faculty that I had the opportunity to interact with and learn from while I was here. And as I've already said, just the feeling that once you are here in the door, everybody wants you to succeed. From the dean to the faculty to the staff to the other students, it's not a competitive environment, it's a welcoming and supportive environment. And that's one of the things that I love so much about the school. Advice that I would give to prospective pharmacy students is to think about your why. Pharmacy school is challenging, rewarding, it's intense, it can be stressful, and you're spending a lot of time and a lot of resources to become a pharmacist. So it's really important for you to know from the beginning, what is your why? Why do you want to be a pharmacist? Why do you want to go to pharmacy school? And also give yourself kind of flexibility for that why to evolve once you're here over time with the new knowledge that you are acquiring and the individuals that you're adding to your professional network.